Hi, so I want to talk to you about an herb combination that is also good for influenza. I have a couple different variations on it. I used a similar combination for the swine flu very effectively. So one of the things I want to say, I'll go into some of the herbs, but one of the things I want to say is what's important about these combinations is how they're taken. So a lot of times people hear about herbs and they're like, oh, those are great herbs. And yet they're really just doing really low dose. They're just doing a tea bag, steeping it for a little bit, and then it might help a little bit, but it's not going to get you the kind of results that you want when you're really trying to push past an illness and or do strong prevention. So again, I think I mentioned I really love Jeremy's work. So what I have here, I'm going to show you is I have my quart jar and I filled it up with filtered water. I'm just doing a normal preventive couple day dose of some herbs. So I put 7 cups in for 2 days and I'm hoping that it'll give me around 6-ish cups. Then I also have my scale, which I just already put all the herbs in here. They had just started to boil, so I'm going to turn them down and find a lid. And then now that we found the lid, we're gonna let it. So we did the boil for 5 minutes and then simmer and then simmer for 10 minutes. So boil for 5 minutes and then simmer for 10 minutes. Okay, so what are these herbs I'm talking about? This combination in particular I'm using is yarrow, which is achillea, salvia, which is sage, and mint, mentha pip. So what is so special about those for right now? Now, these are special because the salvia in particular really helps with sweating. It also is a bit of a tonic. It helps with the immune system. It's antimicrobial. It helps clear out some phlegm. And then the achillea is also another super herb, basically. It is awesome for colds, fevers, but it also is good for post-febrile. So after you have a fever, it helps you recover. It's also known as a soldier's herb because it was used to pack on wounds for healing. So it has this ability to increase circulation and deal with the immune system. At the same time, it helps you recover as well. I use yarrow a lot and I really love it. And mint is just a really great cooling and opening. And if you've ever had a cold and you drink a nice cup of mint tea, you can feel that it's opening. And high dose salvia or sage, you're not going to want to do that if you're pregnant or trying to get pregnant. So another variant would be elderflower. Elderflower sambucus is a really great antiviral and specifically opens up the sinuses. Sage is really good at opening up the throat. However, if you're getting really sick and you're getting chills and fever, I prefer sage. And I prefer sage for the current, like if there's preventive, but then if you feel like you were going to get like COVID, which is what most people are concerned about right now, I would go over this formula. But also I would ask for some help because there's another herb that's really good, I believe, for COVID-19. And that would be cinchona. Now, cinchona needs to be regulated by someone. It's not an herb that everyone should be using. There can be really severe side effects with heart medications. And since the people at most at risk are on heart medications, it just needs to be monitored anyway. But if you're just looking for something to have at home that is really effective, then this is the formula I would suggest right now, which is mentha pip, salvia, and yarrow. Drink a few cups a day, and it'll help regulate that kind of flu or fever or chills fever, or just keep you from getting sick, hopefully. But then if you're actually getting sick and you want to up it, if you're really sick, like you were like, okay, I'm going down, then these herbs are best used 1 cup per hour. And the grams that I was doing, so if again, you're looking at 6 grams per day per herb. So then it ends up being a whole bundle of herbs. And again, I like achillea because there's a heart aspect and a circulatory effect. It's known also as a bitter digestive, a general tonic, immune tonic, and convalescent tonic or antipyretic. So that means if you're just kind of laid out and fevers, basically, and recovering from fevers. So it also tonifies. Both salvia and achillea have a tonification meaning that it boosts blood and qi compared to just purely clearing. Like say elderflower is great, but it's not gonna nourish the deeper systems, which are gonna need support. And defensive qi is the Wei qi, which is your immune system. So it tonifies that. And it also tonifies yin, as does salvia. And so if you're in a situation where you're gonna be losing fluids, either through mucus. So if you think about when your lips get really dry and you're drinking tons of water, but you're sick, part of that's because a lot of your fluids are going into mucus. And so if you're creating a lot of mucus, you need to re-nourish the yin. And the yin is that more fluid-like substances in the body. So clears deficiency heat and clears retained pathogens. The other thing that both the salvia and the achillea do here for us is that if you already have something kind of in your system, a lot of us do and don't even know it, or we do. And so retroviruses or retained pathogens or things like underlying bacteria, Epstein-Barr virus, some of the herpes virus, HPV, you name it, H. pylori. And if you look at the research, most people have those. 80% of people have one or a multitude of those. So what happens is this helps start clearing out a little bit without a big push. It helps treat some of the underlying so your system doesn't get overwhelmed. If you look in places where there's really high infectious rates, I went to Uganda and helped work there on the more Western medicine side with testing for HIV and malaria. And we went into cancer wards. That, I believe, when you see these people with multitude of strong pathogens that they're living with, then when they do get sick, it just right up there. And when you don't have as much, there's hygiene, which is really important, but then, and nutrition. Hygiene and nutrition are so important. However, when you're in an area where people are just have lots of pathogens in their system, another pathogen comes along and it just kind of goes up. It's kind of like also in the cases with people who their immune system is just so busy fighting, just like with HIV. When people get into AIDS, you'll find that they're not dying of the actual virus, they're dying from pathogenic. So we look at it from this achillea is cool, neutral, and warm. So it has a way to kind of modify itself. It's bitter. It also helps get rid of phlegm. It helps with some of the sinus stuff, which is great. So especially if you're not adding in the elderflower, the achillea can cover some of the sinus area. And then let's just see it as far as some of the Western research on it. And I'm sure there's more right now, but it can help you sweat if need be. So it regulates that. That's the Wei qi, the regulating. Helps get rid of fevers, helps get rid of phlegm. And it's not a strong cleansing of like the liver, it's an alterative, but there is a cleansing effect. And that's what I like too. You don't necessarily want to do a huge cleanse push when you're trying not to get sick. You can actually get sick when you're trying to do like a full-on cleanse. It makes your body more acidic, the toxins come out of the cell into the circulatory system, and then your body is dealing with a current infection from the cells into the circulating system, and you don't want to have that when you have other infections that might come in. So you want to keep your body clean and eat well, but you're not necessarily want to do a super detox. This doesn't do a super detox for you. It's a circulatory stimulant. It's astringent. It also helps with bleeding. That's where you get putting it on a wound. And it does help regulate a little bit cycles, but it's really a minor effect of it, and it's anti-hypertensive. So again, that kind of circulatory cardiovascular aspect. And this one does not interfere with cardiovascular medications, whereas the cinchona or convallaria do. Neither of those should be used without a licensed expert for cinchona or convallaria. Okay, and then when you put the salvia with it, you're gonna get also a way to help relieve nervous tension. So some of the stress in the body related to the virus, the immune formula. But so if we look at the Chinese actions versus the Western actions, we've got clearing wind, heat, and clearing heat toxin. Heat toxin could be some of those pathogens or acidity hanging out in the body, or heavy metals or pesticides, that type of thing. Clears when cold, the surface, and the Wei qi, the defensive qi. From the Western way, we might classify the clear wind, heat, and heat toxins as a diaphoretic, and to make you sweat, antimicrobial, or an alterative, so kind of cleansing, antimicrobial. And then we go down to clears heart deficiency heat. So heart deficiency heat, it's in some of the little books. Heart deficiency heat is the best example of that is when people get older. So more in little kids and older people. So I'm just gonna use an example. Let's look at someone who's postmenopausal or going through menopause. And they have energy, but it's kind of this adrenal rushed energy. And they're getting anxious. They are getting a hot flash, but it's not sustainable, deeper, warm energy that's bringing vitality. It's just like, whoomp, and then Chinese medicine, they call that like a deficiency heat. And usually anxiety goes with that. In Western medicine, we look at it having an adrenal response. So, but it tonifies the heart and the kidney and calms the spirit. So it's great, both for kids and for people who might be getting some of those kinds of sudden fluctuations that aren't so productive, kind of this adrenal rush. So then in Western actions, we talk about it being a tranquilizer, a nervine tonic, and a calming liver yang, so headaches, moving liver qi, tonifying the blood. So again, like Achilles, there's a tonic effect of the blood, which is great. In Western medicine, we'd say there's a tranquilizer and antispasmodic. So especially if there's some, like in the lungs or intestines or muscles where you're getting like tremor or shake, then this can be helpful. And this one again has regulated the uterus, and so that's why it has enough of a strong effect. That's why it's not recommended for pregnancy or for if you're trying to get pregnant, at least past ovulation, you wouldn't take it. Maybe before, actually. Sometimes I do that with people. So I think that's some of the things that are important. And in this case, we're really looking at it as well for the sweating aspect. It's just mint. It's a great herb. We can go over it again a little bit more later. But in this case, it's really just opening everything up. So you want to cool and open. When infection happens, it very quickly, as it stagnates, like it gets stuck in the sinuses or the lungs, very quickly turns to a heat form. So the cooling aspect is important. Okay, now let's just take a look over here. The herb is done. So, let's take a look at this. All right, so then you can see it smells so good. And to be honest, I put a little, well, I didn't mention this, I put a little bit of lavender in this one. And that was just for that extra calming effect, just because it's not quite like, I mean, all viruses have an ability to make us upset, stress. Sometimes they even have emotional components, believe it or not. But right now, there's even an added element of stress. So I just added in a little bit of lavender for that effect. And because the intestines in the current virus also, intestines and nausea take place. If you get that virus further down, within usually like a week or so. So the lavender helps with that too. Although, again, I'm using this more preventively. And I just want to show you what I'm doing and how I make it. So then you've got, you can put it in a jar and then just heat it up whenever you're ready to take it. Okay, thanks.